Measuring blood pressure, manual and digital. Blood pressure, BP, is a critical indicator of heart and circulatory system health. For home health aides, HHAs, accurately measuring blood pressure and knowing when to report abnormal readings is essential. In this lesson, we'll cover both manual and digital methods of measuring blood pressure, how to prepare the client, correct positioning, and when to alert a nurse or supervisor. Understanding blood pressure. What is blood pressure? Blood pressure is the force of blood pushing against the walls of the arteries as the heart pumps. It is recorded as two numbers: systolic, top number, pressure when the heart contracts; diastolic, bottom number, pressure when the heart rests between beats. For example, 120/80 mmHg, read as 120/80, is considered normal for a healthy adult. Normal blood pressure range: normal, less than 120/80 mmHg; elevate, 120 to 129, less than 80 mmHg. Hypertension, high BP, 130/80 mmHg or higher. Hypotension, low BP, less than 90/60 mmHg. Equipment for blood pressure. Manual BP tools: sphygmomanometer, aneroid gauge plus cuff; stethoscope; digital BP monitor, electronic device that automatically inflates and records BP. Use the method specified in the care plan or as directed by your supervisor. Preparing the client. Proper preparation ensures accuracy. Ensure the client is seated or lying down comfortably. Arms should be supported at heart level, palm facing up. Make sure the client has rested at least 5 minutes beforehand. Remove tight clothing or roll sleeves up. Don't over-tighten. Explain what you're going to do to reduce anxiety. Avoid taking BP on the side of mastectomy, IV line or dialysis shunt, injury or weakness. Manual blood pressure measurement. Step-by-step procedure. Wash your hands and clean equipment. Wrap the cuff snugly around the upper arm, 1 inch above the elbow. Place the stethoscope over the brachial artery, inside elbow. Close the valve and inflate cuff to 160 to 180 millimeters mercury or 30 millimeters mercury above expected systolic pressure. Slowly release the air, 2 to 3 millimeters mercury per second. Listen for first sound, systolic pressure; last sound before silence, diastolic pressure. Record the reading, e.g., 118/76 millimeters mercury. Remove cuff, clean equipment, and wash hands. Document and report any abnormal readings. Tip: if you can't hear clearly, wait a few minutes and try again. Digital blood pressure measurement. Using a digital monitor. Wash your hands and clean the machine if needed. Wrap the cuff according to device instructions. Ensure the client's arm is at heart level and relaxed. Press start and allow the machine to inflate and read. Wait for the final reading to appear. Remove the cuff and document the systolic, diastolic numbers and pulse. Turn off the device and clean if necessary. Digital monitors are convenient, but may be less accurate if the client is moving or has an irregular heart rhythm. Documentation and when to report. What to record: BP reading, e.g., 122/78. Method used: manual or digital. Arm used: left-right. Client's position: sitting, lying, standing. When to report to the nurse. Systolic is below 90 or above 140. Diastolic is below 60 or above 90. Client complains of dizziness, headache, or chest pain, irregular rhythm, or difficulty obtaining BP. Device malfunctions. Always follow your agency's protocols when reporting abnormal findings. Accurately measuring blood pressure is a vital skill for any home health aide. Your technique, attentiveness, and documentation all contribute to effective client care. Monitoring changes in BP helps detect early warning signs of serious health conditions, ensures your clients stay safe and healthy. Accurate blood pressure readings help detect early health risks. Your skill and attention keep clients safe and support better care.